Throughout history, magicians and wizards used to hypnotize crowds of people with mysterious lights and objects, seemingly brainwashing them into doing amazing things, like walking barefoot on hot coals and having visions believed to be of divine nature. People back then believed hypnosis to be a kind of magic or a manifestation of divine will. But what is it in reality? Well, let me ask if you've ever been in this situation. You're driving in your car, focused on arriving at any particular destination. The next thing you know, you're there, and you don't remember anything about the 15, 30, or even 60-minute drive. Believe it or not, this is a typical example of hypnosis. According to Psychology Today, the average person is hypnotized at least twice a day, and not by outside influence, but through self-hypnosis. This is just one way that hypnosis can be related to our everyday lives, and there are many, many more. That's why today, my goal is to get everyone here at least a little excited about the wonders of hypnosis, but more importantly, teach you about how influential it can be. To do that, first I'll explain the basic science of hypnosis. Next, I'll show you how it's helped create many positive advancements in the medical world. Finally, I'll explain how it's helped people turn their lives around, even in the smallest amounts. And if you open your mind enough, maybe it could even help you. So, hypnotism, you may be asking? Why should I care about hypnotism? Chances are, to you, hypnosis is just a parlor trick. It's freaky, something you'd see on America's Got Talent. That's why first, I'll explain how hypnosis actually works. Just a hint, it's not magic. So, to explore, So, what you probably see commonly all over media is the common representation of hypnosis. A man waving a shiny pocket watch back and forth, guiding his subject into a semi-sleep zombie-like state. Once hypnotized, the subject is compelled to obey. This simplified representation bears little resemblance to actual hypnotism. So, to rid ourselves of that impression and to fully understand hypnotism, let's look at an example. In an experiment reported in the New York Times, subjects were given the Stroop test. You've probably heard of it before. Words are displayed are words that are the names of colors, except the colors of the words are other colors, etc. It's almost impossible to do correctly due to an interference effect that causes the meaning of the words to take priority over their visual color. The Stroop effect was seen in the subjects of the experiment when they took the test. However, they then were hypnotized to believe the words they were seeing were in a foreign language. So instead of actual letters, they saw gibberish. They were then able to do the test effortlessly. Not only that, but the MRI brain scan revealed that the brain region responsible for language did not become activated. So not only did the words seem to be in a foreign language to the subject, the brain processed them as if they actually were. This experiment is considered by some the first substantial evidence that hypnosis is a real neurological phenomenon. But what kind of phenomenon is it? Well, hypnosis is a state of extreme suggestibility, something that includes the placebo effect, advertising, and religious cults. The way hypnosis affects the brain can help explain how it can have powerful effects, including tamping down stress, anxiety, pain, and self-consciousness. In other words, with these potent effects, hypnosis can entirely change the way that medicine is treated. To explore this use of the practice, let us refer to Dr. David Spiegel of the Stanford University School of Medicine. When Dr. David Spiegel emerged from a 3-hour shoulder surgery in 1972, he didn't use any pain meds to recover. Instead, he hypnotized himself, and it worked, to the surprise of everyone but Dr. Spiegel, who had studied hypnosis. He believes that hypnosis practice can and should be used instead of painkillers in many cases. His previous research has shown that when people in pain are taught self-hypnosis, they use half the pain medication and have half the pain than those who are just given access to opioids. Now that we realize the addiction potential of opiates is very high, it's possibly a precious alternative, and it's a shame that we're not making better use of it, he says. Overall, hypnosis is a treatment that should be given the same respect that a lot of other treatments we use that are sometimes less successful and more dangerous. So why don't doctors and hospitals use it more often? Part of the reason may be its stigma. Patients and doctors may think of it more as hocus pocus than science. Another reason may be problems with the quality of hypnosis studies, leading doctors to be wary that it wastes time and money. But all of these are misperceptions. Let's look at a specific patient, Marilyn Palazzo. In 1987, she was diagnosed with irritable bowel syndrome, a disorder that was for her debilitating. She was housebound, spending hours a day suffering from abdominal pain and diarrhea. Over the last 12 years, Palazzo tried medications and diets to no avail. Then, as a last resort, she started listening to audio tapes to treat IBS through hypnosis. They made a difference, and now she says her symptoms are virtually gone. Maybe hypnosis isn't as reliable as regular medications, or maybe it's more reliable. The effects of different types of medications can change for every patient, but hypnosis affects the brain, and that's the same for everyone. If not in more extensive procedures like Dr. Spiegel's shoulder surgery, hypnosis should at least be used instead of expensive procedures and medicines that are of no avail. Hopefully by now you understand that hypnosis is real in medicine and is a viable option. Yes, that's useful and hopefully enlightening information, but it may or may not apply to your life. However, what would you say if I told you that hypnosis could help you change things about yourself that keep you from accomplishing your goals? Put simply, hypnosis can help reprogram the mind with different beliefs, says hypnotherapist and life coach Marilyn Palazzo. Self-hypnosis can be really helpful if you're trying to overcome something, such as a fear, but also for anyone trying to break negative or unhelpful patterns of behavior. According to Jill, people living with OCD, PTSD, anxiety, or depression can use self-hypnosis to bring about truly transformative results. It's a genuine alternative to meditation or therapy, helping people to take their meditative experience to a deeper level. We could also look at a simpler example, because it doesn't always have to go that deep. Procrastination, something that affects people all over the world. Self-hypnosis for procrastination is a common practice. All it requires is a quiet place, a few minutes, and a hypnosis script. Do you doubt that it really works? Well, a recent 2012 study done by Mayo Clinic examined how hypnosis could help 60 patients with generalized anxiety disorder overcome procrastination and reduce overall stress and anxiety by many levels. Overall, hypnosis could be anything to anyone. To some, it's a silly game that shouldn't be taken seriously, and to others, it's scary, which is all okay. Some people have a use for it, and others don't. Hypnosis has been gaining a lot of traction in recent years, when considering how popular hypnotherapy is in the medical world. But don't get me wrong, I'm not telling you to become a hypnotist because of all the opportunities there are, but I'm also not telling you to up your life and dump all your problems on a hypnotherapist expecting them to be solved. I'm just opening your mind to the options that are out there, because whether it's just a parlor trick or not, hypnosis works, and it's up to you to decide how you'll use that to your advantage. Thank you.